Good evening, everyone. Thank you so much for joining us here in person and online. We are live from the barber shop at 4551 Newbern Avenue. Thank you all for hosting us. um, we have our group of panelists here that I will introduce in just a minute, but I'm Dr. Rashida Monroe. I'm the moderator tonight for the Ask the Doc Town Hall. Tonight, we'll be discussing discovering mental health and wellness during the time of COVID. We'll also give some COVID-19 vaccine booster updates. So since 2019, as we all know, the whole world has been dealing with COVID-19, the pandemic caused by this new virus that called SARS-CoV-2. It's caused problems in healthcare, economies, people's everyday lives, and beyond. To handle the ongoing pandemic well, it's essential to stay updated on the latest information about COVID-19, about how it spreads, how vaccines can help, and what public health measures are necessary. Being well informed will help us manage the situation better. As of October 5th of this year, among reporting hospitals, there were 14,910 hospital admissions for COVID-19 in the United States. So we are not done with COVID, as my kids would like to think. Mental health is an essential part of our overall well-being. It's encompassed by our emotional, psychological, and social state of mind. It affects how we think, feel, act, and it plays a crucial role in our daily lives and the way we interact with others. So just as physical health requires attention, so does our mental health. It's really important that we acknowledge that mental health issues are very common and can impact anyone, regardless of age, background, or circumstance. So by promoting awareness and understanding and support for mental health, we can create a more compassionate and inclusive society where individuals are empowered to seek help and lead fulfilling lives. I'm excited to be joined today by our group of panelists. I have Dr. Danielle Robertson-Keaton, an adolescent and adult psychiatrist at WakeMed. I am also joined by Wendy Watson, MSW and North Carolina Central University professor and the executive director and founder of Empowered Citizens. And lastly, we are here with Rodney Harris, PhD, an associate professor with the Chicago School and chief clinical officer of the ETC group. So in just a little bit, we will take some questions live here at the barbershop. We will take some questions from our viewers online, your questions about COVID and mental health. But first, let's just remind you about where we are with vaccinations. So the updated monovalent COVID booster is now available in pharmacies, at Wake County Health Departments, at primary care offices, and you can go on wake.gov/vaccines or call 919-250-1500 to either do the vaccine locator and see where you can get vaccines, or you can call to make an appointment. The vaccine is available for adults and children all the way down to 6 months old. And even if you've been boosted in the past, if you just got your booster this summer or last year, if you have not gotten the update booster that's available starting October of 2023, so just in the past month or so, if you've not received that booster, then you need to get that to be considered up to date with your COVID-19 booster. The vaccine is no longer free for all. It does require either insurance, or if you don't have insurance, or if you do have insurance, but your insurance doesn't cover the vaccine, there is the Bridge to Access program. You can go to local pharmacies. You can go again to a Wake County site, and you can say, I need to get my vaccine. It's not covered by my insurance, or I'm uninsured. And they can get your vaccine covered for free to you through the Bridge to Access program. So don't let that be a deterrent to you getting vaccinated. All right. Let's let's get started. First, I kind of want to open it up to our panelists. And if I could have each one of you introduce yourself, just a brief introduction. And if you can just tell us, you've been practicing in the mental health space for a long time and throughout the time of COVID. Can you tell us what type of populations or communities you see and what type of things you have seen? What are people struggling with right now during the time of COVID? So introduce yourself, what communities or populations you serve, and what you're seeing people still struggling with. I'll open it up to you first, Rodney, because you're right here beside me. Look, you'll note, either don't sit close to me or don't make eye contact, because then you'll have to go first.
Well, I didn't get a choice about it. The other two seats were taken, so I got this third seat, but I don't mind. So, of course, my name is Rodney Harris, Dr. Rodney Harris. I teach at the Chicago School of Professional Psychology, and I teach in the Counselor Education and Supervision Department. I also have a practice and do a lot of work with a wonderful organization called the Village of Care. It's a community collaborative. It's community-based work, great deal of that. So what have I noticed? Particularly how our communities are grieving and hurting and really looking at a lot of complicated grief and trauma, because particularly in communities of color, there were ways that we grieve, and as far as like ways we supported families that we weren't able to grieve during COVID. And I think the after effect of that is we're seeing some of that and how people are having these multiple levels of secondary trauma. So it's grief on top of grief. They lost loved ones, they weren't able to work, they weren't able to see their friends. And so as this grief is complicated and as it's accumulated, that it also begins to have this effect on our minds, our bodies, and our souls. And so we just accustomed to kind of carrying it around. We just suck it up and we just go on. And I think what we're seeing now, particularly in our communities, with our children, as we look at some of the depression, grief, suicide rates. We predicted this a number of years ago, that the numbers were going to, as far as them going to the emergency rooms, we saw that the long-term effect would be the suicide rates would increase. So we noticed that grief, and that's how it's now manifesting in our communities.
Thank you so much for sharing that. Complicated grief. It's hard to grieve the loss of a loved one no matter what, right? But when you weren't able to be there at the end for them, when you weren't able to say goodbye, things like that really can make that even more challenging. So thank you for bringing that up. That's a really important thing to consider. We'll pass the microphone to Dr. Danielle Keaton. Please introduce yourself. Let us know your area of practice and what types of things you're seeing during this, maybe we'll call it post-COVID, but during this time of COVID and beyond.
So I am Dr. Danielle Keaton. I am a child and adolescent psychiatrist. I'm also trained in adult psychiatry as well. I mostly work in the inpatient setting. So in the hospital setting, I see kids that come in for all types of mental health crises, kids who come in to the emergency department with suicide attempts, with aggression issues, with other social issues, and try to address their needs in the acute setting and then determine what level of care they need. Right now, we're seeing a large increase in all children of all ages for all types of mental health needs. And there is a system issue and a system problem because kids they're struggling, but there's not a lot of resources in place already for kids with behavioral disorders or families that are struggling with children who have legal issues, or they're not attending school, but they're causing issues at home or in the streets. So they end up in our emergency room, and we're trying to manage multiple different situations with limited resources. So we are trying to, get information out regarding the need for like assessing kids before they get to that acute crisis situation. So it's really important that we notice, during COVID, kids were isolated and withdrawn and they were home and they weren't in school. And when you're looking at like pediatric patients, their world is so small. And so school and their friends is a big part of who they are. And so they were kind of forced to have limited, they were in social isolation. And so we noticed definitely an increase in depression, anxiety, issues with parents, because kids tell me like they had no, space.
Right.
They had no privacy. They were kind of forced to be at home alone with, their family. Maybe they didn't have outlets. So those are some of the things that we're kind of noticing now. It's just, we're trying to pick up the pieces after kids have really, their lives have been disrupted.
Yeah. Yeah. Thank you for mentioning those things. I'm a pediatrician, of course, at Wake Med. And, prior to the pandemic, we were seeing this uptick and anxiety and depression in children. And then after the pandemic and during the pandemic, it just really seemed to increase exponentially. And isolation for anyone, right, can really cause some mental health problems. But you add on top of that the fear and anxiety and disruption of their social network, and we're really seeing the consequences of that, aren't we? Yeah. You also pointed out how mental health resources generally are insufficient, and especially when we're talking about for children. So it really is a challenge. We're glad to have you. Thank you so much. Wendy, we are going to hand the microphone over to you. Wendy Watson, tell us a little bit about yourself and your practice and what types of things you saw during this time.
Sure. My name is Wendy Watson, and I am the executive director and founder of a nonprofit organization located in Zebulon called Empowered Citizens. And so we primarily serve youth. I also teach at North Carolina Central University in the social work department. And what I'm seeing working with youth, I am seeing an increase in anxiety and depression, maladaptive behaviors. I'm seeing an increase in substance use as well. So I'm seeing the co-occurring disorders, a mental health disorder occurring with a substance use disorder.
Yeah.
So I'm seeing youth that are, not only smoking marijuana, but they're using opioids. So I'm definitely seeing a lot of that. I'm seeing delinquent behavior. And so we know that untreated mental health and substance use is a risk factor for juvenile delinquency. So seeing that as well, seeing conflict in families. So kids, having those conflicts within the family, within the homes. So a lot of behavioral issues.
Yeah. Wow. Thank you for bringing up substance use, right? Like substance abuse, that's really important. And when you're layering that on top of this mental health crisis, things are really getting complicated and things that we have to think about and address. So thank you so much. Well, we're going to open it up for questions from people live in the shop and online. One of our first questions, and if you have a question, if you're live in the shop, if you just kind of come stand right here at the microphone, then we'll give you the opportunity to ask your question. One of the first questions we have is, you all are telling us about these mental health disorders that you're seeing. If you are worried about a family member, whether it's your child or a loved one, what are some of the first signs and symptoms you might see to suspect that something is going on where they might need some help? And I want to start with you, Rodney. What types of signs and symptoms might people look for?
I think it's really important that you pay attention to changes in behavior. So if a child was normally very active and very social, then all of a sudden that child starts to isolate and physically, socially from their family or friends. You might also pay attention to changes in appetite. or even sometimes it might be quite the opposite. They may be quiet and they may become more aggressive. And you want to pay attention to those types of behaviors. That's what I'm really looking for. And I do a lot of work with men, a lot of work with young boys. And so if I'm seeing that uptick, I'm saying, okay, let's pay attention, because they have the saying from Skinner that all behavior has meaning. And it's really important that we pay attention and find out what's underneath the behavior, and take time to really address that, so that our eyes are in tune to what the behavior is. And also, I think what's most important is you don't ignore your hunches. I think sometimes we'll say, okay,
Your
it's going to go away.
intuition,
That intuition, that particularly when you notice, and who knows their child better than mother, better than the father. And so if you notice these changes in behavior, that you just don't ignore them, pay attention, and know that there's help out there.
Yeah. Thank you for saying that. As a pediatrician, I think one of the most important things we can do for our children is just to be in communication with them, right? And for them to know that there is a safe space. And so if you're in constant communication with your child and they know that's a safe space, you might get that intuition. Something's different, right? These behaviors are changing. They're not acting like themselves. Dr. Keaton, anything else you'd like to add?
Can I make just a brief comment?
Please.
So you talk about safe space, and we try to introduce the concept of a brave space. And so that's a space where you can, particularly through the Village of Care, where you feel comfortable to bring up topics and address issues that you normally may not discuss. And so you create this atmosphere. And I deem the barbershop as one of those safe spaces and a brave space. And one of the reasons that we do a number of our interventions and a great deal of work that we do here is because we know that this is a safe place in a community where people can come to in times of chaos, in times of trouble. And also, really, some of our first responders are right behind the chairs.
How many times has my beautician been my therapist? We talk it out, we hash it out, right? So this is a safe space and a brave space. Thank you for bringing that up. Dr. Keaton, anything else that you'd like to add? What should people be looking for, whether it's in their child or loved one? Anything else?
So I would say the other thing is just noticing, like for pediatric patients, their change in like academic functioning and like a decline in like their school behavior or school refusal. That is a lot of behaviors that I notice in kids who are really struggling and wanting to make sure that why they do not want to go to school, and asking questions about bullying and creating safe spaces for your child to be able to come to you like when they are not having a good day, and kind of making it a regular routine so it doesn't feel like they're being attacked, but it's like, okay, every night at dinner, we kind of check in and we just see, how was your day? Is there anybody bothering you? Was there teachers that were getting on your back about things? So just normalizing those behaviors and those conversations can be really helpful.
Yeah. I like how you said the check-in at dinner. Again, as a pediatrician and mom to two teenage boys, I have two teenage boys now, y'all. One just became a teen. I really firmly believe in the family dinner. It doesn't have to be anything fancy. We're not talking about fine china. It can be a box of pizza on the floor with everyone just kind of checking in and chit-chatting about their day. That's a phone-free zone. And it gives people, when there's not that distraction, right, it gives people the opportunity to talk with each other. And, even if my kids are not in the mood for talking, I might be talking to, their dad about what went bad in my day and how I dealt with it. But they're hearing that communication. They're hearing that debrief. They're getting used to we talk about how things went. And even when it wasn't pretty or great, we're talking through it. And so the family dinner is one of the most important things that you can do. A phone-free family dinner for your adolescents, and modeling that kind of debrief is going to be really important.
And particularly as you talk about expressing your feelings and your emotions, because oftentimes that's not modeled for families. That's not modeled for us, or the appropriate way to express feelings and emotions, and that you take that opportunity to say, what, my day wasn't necessarily a great day today. And that you can name that and say that, and we can talk about it. And I think that's really important as a family to be able to name a feeling and be able to identify that.
Yeah, that's great. So, okay, families then, they're listening in, they're checking in, they've created this safe space, this brave space, hopefully, and they're noticing things, right? Whether this is again with their adolescents or with their partner or their mom or whoever it is, they're noticing that something's not quite right. What do they do about it? Are we talking with them? Are we confronting them? Like, what resources are there for people who don't really know what to do? Their gut says something's not right, but then what? Wendy.
I think it's important when we're noticing signs and symptoms, we also want to monitor how long and how often are we seeing them? Because when we are, as clinicians, diagnosing disorders, we look at the duration that is happening, the frequency. So how long are we seeing it? How often is it happening? And that's definitely, a sign that we should have a conversation or reach out for help. But if it's a parent, you certainly want to approach the person. You want to listen non-judgmentally.
Mm-hmm.
Your language is going to be very important, as well as your presentation. So a lot of times when we're approaching kids or anyone, it's all in how we approach them.
Right.
And we want to ask the question. We want to let the person know what it is that we've noticed different about them, and then ask, is there anything I can do? How can I help?
Right.
So I think it's in your presentation, but you definitely want to approach and assess.
I like it. I like how you said listen without judgment.
Yeah.
Right. How we approach is going to be really important. We have a question. Fantastic. Let's see. How about, should we give the microphone? Yeah.
Okay.
Thank you.
So my question is, I have a sister who is clearly going through something like a lot. She's been in mental hospitals. She's been taking drugs. So it's like we're trying to create a support system for her, but at the same time, she shuts us like down. So like, what should we do there? Like, we call her, hey, how's your day doing? Like, and she'll like kind of go off and be like, leave me alone.
Yeah.
Give my space.
Yeah. Wow. That's an excellent question.
Yeah.
Thank you for asking that question. That's a brave question. So the question is, if you have, a loved one who is going through it, right? Whether that's mental health concerns or substance abuse, and they're just not really ready for the support, right? They're kind of shutting everybody down. You've tried to create that safe space. How do you approach that?
Well, it's a great question, and thank you for asking. It is difficult, very challenging when you want to support someone and they're just not ready for it. And sometimes people are not ready. And I would say continue to be that support, making sure you're letting the person know that you're there if they want the help, if they need the help, but not forcing them. Because, we may want a person to change, but sometimes people don't think that they have a problem. And so we have to continue to support them until they get to a place where they're ready for the help. You want to add to that? Thank you.
Yeah. Anybody else? Excuse me.
I think the only other piece I would add is the importance of self-care, of taking care of yourself and taking care of your family. When you're going through an ordeal like that, having supported other families through that, sometimes they can become so enmeshed in the issue that they forget about taking care of themselves. So I'll offer to you the importance of taking time to breathe, hearing, and know that there are other support and resources out there, but also make sure you're taking care of yourself so you can have something to pour in. It's really important.
That's a really good point. So you brought up self-care, whether it's to support your own mental health and wellness, or kind of the secondary trauma of really supporting someone else who's going through a really challenging journey. What types of self-care, when people say self-care, on Instagram, you see like, in a bath with, wine and doing your nails or something. But like, what other forms of self-care do you all recommend that can be really helpful? And if everybody just kind of goes down, like name like a form that you recommend to your clients.
So for me, it's really important that I'm grounded. And so a simple technique that I pay attention to is I'm always mindful of my breathing. And so if there's something that happens, and I'll say, Rodney, breathe. And I'll be mindful of my breathing. And then the other piece that's really important to me is I walk. And so it might be I just need to circle the block, circle the building. My neighbors probably see me circle my driveway or circle the cul-de-sac probably 20 times a day, because if something is in my head and I need to process it, I will circle, I'll walk. And that's my way of getting grounded, paying attention to how I'm breathing, and I'm getting myself in tune with my body and my mind, get my soul like that. So that's really important, something to do. Water too.
Yeah,
That's
drink
really
enough water. I love
important.
it. One of my favorite things, I like to call it joyful movement, right? I don't like to say exercise because to me that sounds hard, but joyful movement. And so walking, sometimes, I've implemented this walk around Wake Med in the middle of my day, because sometimes I just need to get outside and get away for a minute. And so I'll just take a lap around the whole outside complex. But being in fresh air and nature and just going for a walk, I love that one. Dr. Keaton, is there one that you like to recommend?
So I was going to say deep breathing, because that's a common one, in helping kids to kind of notice their breathing and the way that their body is responding to some of their thoughts is a really good way to help, soothe your body and to relax. Also, like taking a warm shower or a bath, just to like feel again that warm sensation on their body to help them feel that physical like relaxation. Also journaling and just, talking to friends, or just taking some time to separate yourself from a situation that may be stressful. And I like to remind my patients that, one day isn't the entire world. Like you are allowed to have a bad day.
Yeah.
So you get to start over the next day. And sometimes just saying like you're done for the day is enough to help you kind of feel energized and be ready to move forward.
I love that. I do have to sometimes just say, I'm done for the day. This day is done. I like that.
In addition to all of those things, engaging in things that you enjoy doing, but I would say also being able to set boundaries.
Yeah.
Because a lot of times we don't always know how to set boundaries. Prime example, I was working with a youth who said that their dad told them, because they were using substances, that they were going to be just like their uncle. And their uncle had passed away from using substances. And so how it made them feel, it was very hurtful. And so I explained, sometimes as a youth, you can also set boundaries with parents. It's just the way that you do it. And so I explained, letting the parent know how that made them feel by saying that, not disrespecting your parent, of course, but just letting people know how their actions may make them feel. So I think setting those boundaries can help, with self-care as well.
Excellent. Those are all excellent strategies. Thank you all. We have a question from our barbershop live. So if you all want to introduce yourself and let us know your question.
I'm AZ. I'm 17. I go to Enlo, and I work with Southeast Raleigh Promise, and we work on mental health. And my question is, what do you guys think the main reason that people? What is the main reason that people can have mental health problems? Like, I know everybody go through like different situations and stuff. Like, what do you think the main reason is for mental health?
That is an excellent question. Thank you.
And I like
so
the
much.
barbershop scenario, by the way.
You like this? Yeah, this setup is kind of cool. I agree. So did everyone hear that question? There's lots of factors to consider, but what are some of the main reasons that people may have mental health, issues? And Dr. Keaton, I want to pass the microphone to you.
So that's a really good question, and it's a difficult question, but I'll try my best to like sum it up in a way that everybody can understand. So there's many mental health disorders, but they all have different contributing factors. So we like to talk about like a biological, psychological, social approach to a lot of them. So there usually isn't one gene that causes your brain to have, you know, a schizophrenia diagnosis or a bipolar diagnosis. Some people may have that in their family, so they have maybe a higher risk of developing something like that, but it doesn't mean that you're going to have that.
Okay.
So it is important to consider the other things that kind of make up your whole body. And so your social situations, if you're always in a stressful environment, or if you live in a stressful environment, or your family situation, if you're homeless, those are things that can contribute to your stress level, which can contribute to the way your brain processes things and make you more at risk for developing a mental health disorder. So there's a lot that goes into play, but it is a whole system of things that can contribute to you developing the disease. Does that answer your question?
Thanks so much for this.
I thought she did pretty good with that. Like, I felt like that helped me understand. I like how you said the biopsychosocial model of understanding mental health. So thank you so much for that question. All right, we have another person live at the barbershop with a question. Introduce yourself and what's your question?
Hey, how y'all doing? My name is Stephen. I'm a junior at Enloe, and I work with Southeast Early Promise as well. And my question was, how does social media impact mental health?
You guys are coming with the questions. Those were both fantastic questions. How does social media impact? Right? Everyone goes, How does social media impact mental health? I think you guys have been here. You guys have been with the Ask the Doc before. You guys are seasoned vets and did a really good job. So, okay, who wants to take that one? How does social media play in? Okay.
So with mental health, it's our thinking, the way that we feel, and then our behavior. So thinking, emotion, behavior. And sometimes I think with social media, we're exposed to so many different things, right? And a lot of times we compare ourselves to people that are on social media. And so on social media, we're showing our best selves, right? And so if I'm someone who may have low self-esteem or just maybe comparing myself to someone on social media, that may make me think, oh, I'm worthless, I'm less than, I'm not good enough. And then that's going to create an emotion because now I'm comparing myself to someone else who looks like they got it going on. And my life may not be as what I'm looking at, right? So I think because we are so we're exposed to so much, we compare ourselves, and so in doing that, then we start to think, and then that creates an emotion, that creates a behavior that may be, you know, I'm less than, so of course that's going to make me sad, so I might isolate. Yeah.
Yeah. I think another piece, and I think she definitely, she talked a little bit about it, is how social media contributes to anxiety. And that's what a great deal of the research is discussing now, how anxious it's making our kids and the contributing factors around it, and how the anxiety is driving depression and how they just kind of commingle, and their inability to manage the anxiety. And so I think that's what the latest pieces of research is saying, that, you know, the amount of time that teenagers are spending on social media, and that the need to always feel like they have to be on, that constant need to be on and present, and the inability to put it down, that kind of exasperates, makes the anxiety worse. You know, I gotta have it. I have to have it near me, and the anxiety kind of makes the other problems worse.
Yeah.
You want to say something?
So the other piece with that is sleep. So, I mean, we never unplug from our devices, and that can be a major issue. When kids are trying to go to school and they're up all night and they're trying to do TikTok videos and trying to Instagram and all the Snapchats and all of those things, the sleep is really, really important. And so you notice that the kids are up all night and they're not getting the rest they need. And so it's really important to try to cut screen time off, like at least 2 hours before bed. It's very difficult for most kids, but you'll notice that your sleep is a lot better when your mind isn't so overstimulated when it's time to rest and unplug. The other piece that I thought of was bullying on social media. It's extremely a problem right now. Kids are really being bullied online, and it's like websites about children in high schools and things. So that is something that I do urge parents to pay closer attention to. And sometimes it's better to just cut the internet off the phone if you can't really feel like your child can be safe, or you can't control something. They may need your support to do those things, because it really is bad. I mean, kids are saying to other kids, kill yourself. Why don't you just go do that? And so teachers often don't know, but it is good to ask, like, are you being bullied on social media, and try to help kind of navigate that situation.
Thank you so much. Say that again. Okay, let me follow up with that. I'm so glad you guys brought up some really, really excellent points. As a pediatrician, we actually recommend that children don't have access to social media before 16, that they don't have access to screens behind closed doors in their room. They don't need TVs in their room. They don't need to be behind closed doors scrolling or watching different things that, one, we don't know how much, and we don't know what the quality of it is, right? So we really recommend limiting screens for young children almost to none, and then not more than 2 hours a day in total for children, after about toddlerhood, and not having social media before you're 16. Imagine this. Imagine you were in school in the, 80s like I was, and you got picked on during PE like I did. And it was terrible and it hurt your feelings, but when you got home, you were safe. And you played outside with your neighborhood friends, and your family supported you, and you were able to navigate that situation. Imagine now, though, that those bullies came home with you, and you never got away from them, and you never felt safe. That's what social media does. I also see friends in groups together. I see teenagers, and they're in a group, and there's 5 of them, and they're all doing this. And they don't even have conversations anymore. They may be Snapchatting each other, and they're side by side. They've lost the art of connection. They've lost the art of conversation, and they never get bored, so they don't even know how to be creative and fill time. And I needed the extra time to talk about that, because I am passionate about the harms of screens and social media in our teenagers. And we are seeing an increased rate of anxieties and depression because of it. If I could think of 4 things so far that we've talked about that I really want people to leave with, like if I were to do one thing in my family, in my friend group, that can really help improve mental health, I think, 1, get enough sleep. Thank you so much for saying that. No one's getting enough sleep. And it impacts your mental and your physical health, your anxiety, your depression. It impacts everything. It impacts your rates for cancer and diabetes. It impacts everything. Get enough sleep. High school kids should be getting at least 8 hours. Middle school kids, at least 10. Elementary school kids, at least 12, around 12, right? So sometimes I'm seeing like 6-year-olds who are getting 8 hours of sleep, and parents think that's enough because 8 hours is what you're supposed to get. No, that's what an adult should get, right? So 1, get enough sleep. 2, something that's mindful meditation, joyful movement, something you enjoy that helps bring you peace, right? 3, family meals. Gather around the table. Doesn't have to be fancy, doesn't have to be, it doesn't have to be every single day, but pretty regularly without screens, gather around the table. And number 4, avoid social media before they're 16, limit screens and social media. I think if we all were doing that really well, we probably could make a lot of progress towards improving mental health, especially in teens. Do we think? Yeah. Okay, we have another question from
Thanks for
live.
answering those questions. My second question was, what are ways to cope with anxiety, specifically social anxiety?
Excellent question. So what are some of the strategies to coping with social anxiety?
So I see a lot of kids with social anxiety, and typically they're kids who go to school. And so it's really hard to have social anxiety and you need to go to school. So usually we start with trying your best to be in the situation that makes you anxious. So if it's talking to new people, trying to kind of just test that out. So if it makes you anxious, don't avoid it. That is like the key strategy we use. You don't want to avoid it because all it does is reinforce that feeling of I'm safe when I don't do this. So the best thing to do is like put yourself in situations, and it may take baby steps, but doing that. So sometimes kids are completely refusing school. So we tell parents to have them like really push, say, no, you have to go to school. But we're trying to aim for maybe 3 days a week at first, and then trying to slowly get them to say, hey, see, you went to school and you were safe. And this is actually what you accomplished when you went to school. So you can do that. When it's really bad, we can treat it with medications, but the goal is to use therapy strategies along with medication. And usually anxiety disorders come in groups. So if you're socially anxious, there's a chance that you also have other anxiety disorders that can be treated with medication as well. So other anxiety disorders include like obsessive compulsive disorder. So OCD is not really a lot of times what people think OCD is. Sometimes the washing the hands many times a day is a good example, but sometimes it can just be thoughts, like thoughts that just always on your mind that you can't get rid of, and you don't like those thoughts. So it kind of takes up more time of your day. It makes it hard for you to concentrate. So those are things that can show up with other anxiety, as well as like separation anxiety for the younger kids when they're refusing school and they're worried about something bad happening to their family, so they just can't leave the house. Or generalized anxiety disorder. So that's just your constant worry about any and everything, where you just feel like you have a lot of questions, or this is going to happen, or is this going to happen? What's happened today? Repeating conversations in your mind about, things that you talked about. So those are other things that you can see in kids, your age, but you can also see those things in adults.
Yeah, I use what I call the thought stopping process, because a lot of times with anxiety, it's what I'm thinking. It's excessive worry about something. So changing the thoughts, and sometimes that takes work and practice. So when I have a negative thought, I need to be able to identify it, know that, this is a negative thought, and change the thought to something else, something positive. So positive self-talk is going to be something that's going to help as well. Positive affirmations, the mindfulness techniques that are used. But yeah, it really starts with my thinking. I have to change my thinking. And that, again, can be challenging, but we have to practice.
Okay. Thank you. Positive self-talk, that takes a lot of practice, doesn't it? Because sometimes our internal dialogue can be pretty negative, especially with those outside forces and messages. You're not good enough, or, so it really does take practice. You all talked about some different strategies and types of therapies. Um, uh, what other types of like resources, as we're getting closer to time, what type of resources should people consider? How do people get referrals? How do they get in to see somebody like you all? How do they start learning these strategies?
I think there's a wealth of information, even though when we talk about the internet, there's a wealth of information on the internet. As I think about, an app called Calm. And I know there was a time that, for me, listening to music and being able to, debrief, being able to hear music. So that's something that I've used. I think as far as like getting access to counselors and therapists, we know that right now it's kind of difficult, but I think as far as like reaching out, most of our numbers, our information, our companies are on the are easily accessible. I think the other piece that I just kind of want to say is the importance of the mind-body connection. I think we've just kind of been talking a little bit about that. You know, I've been really in tune with, I do something called brain spotting, and we talk about trauma, complicated grief. And so just the importance of being still and paying attention to what our body is feeling, thinking and believing and tapping into that and like unpacking the trauma. So,
I like that you mentioned the Calm app, which has brought like meditation really into people's like palms, right? Like mindfulness and meditation. What other are there other like modalities without giving out everyone who's watching your cell phone numbers and giving them access to you all? You know, what about like a betterhelp.com, or what about going to your pediatrician or your family doctor and asking for a referral? Like, how do you tell people to access these resources more broadly? Is there any specific resource that you guys tell people to use that are?
So the managed care organization Alliance Health is a good resource because they can connect you to organizations in the community.
Yeah, in Wake County specifically.
In Wake County.
Mm-hmm.
Well, they actually, so Alliance Health, they manage Wake County, Durham County, Orange County,
Mm-hmm.
even Charlotte. What county is that? Mecklenburg County. So it's different counties that they cover. Also, your pediatrician, your MD, your school counselor. You have social workers that are in the schools. Right now, they are allowing organizations to come into the schools to provide therapy. Mental health first aid. I see that the barbers here has taken mental health first aid training, but there is adult mental health first aid.
Wow.
There is youth mental health first aid, and there's now teen mental health first aid. And so your teen mental health first aid trains teens to be able to identify signs and symptoms among their peers, but also to help them connect with adults. So I think that is one, which is the National Council on Mental Well-being. So that's becoming very popular. It's helping to reduce stigma, but also bring awareness.
Yeah, that's great.
And I think you talk about decreasing stigma. I think that's one of the other reasons that we're here. And I think to be able to have a healthy conversation, dialogue about mental health, and I know it was really important to the owner of this shop as we began to talk about the importance of getting mental health first aid offered, and to be able to talk to clients, to be able to talk about name depression, particularly as we were going through the pandemic, and that they were still coming and being present, of knowing how to name feelings, knowing how to refer, and begin that dialogue. And I think that was really important that everyone here.
Wow. Thank you for pointing out that mental health first aid. You know, we were kind of saying how culturally the barbershop and the beauty shop are places where you kind of talk through stuff, but to take the step to really get that training so that when people are talking to you about those things, you're able to kind of point them in the right direction. That's fantastic. Kudos to the barber shop.
And did you all have accurate information?
Accurate information, right? Awesome. Did you guys have any other questions? All right, fantastic. Any other questions while we're live? Here, let's pass down the microphone. Yeah, thank you all. Good to see you. You want to come grab the mic? Yeah.
988, importance of it.
I'll let you go ahead with your question.
Yes. So I have small children, and I'm also married to a therapist. So I hear it all the time. But what seems to me, and you guys correct me if I'm wrong, it seems like there's no place for tough love and mental health anymore. Is that the case now, or not? Because I grew up like hey, I'm gonna make sure that you know that this world is tough, and sometimes I'm gonna be tough with you. But I should say, however, sometimes what I come in contact with is, oh, well, it's gonna be okay, or oh, well, here, let me hold you, and that ain't always the case. So I just want to know, is that just something we steering clear of now? Because I never hear anybody mention or talk about tough love anymore.
Yeah, wow, that's an interesting question. Um, and when you say tough love, I don't know what your idea of tough love is versus, it sounded like you were saying tough love is like the world is hard and it's okay for things to be hard and um, you know, yeah, the world is tough. Suck it up. All right, tough love. I feel like there's probably room for a lot of different styles, right? And sometimes there's someone needs to be scooped up and they need to be hugged. And sometimes they need to be reassured that they have the tools to get through it and it's going to get better. And yes, this stinks. Whatever you're going through, it stinks. It sucks. Whatever. But you're going to be okay. But what do you guys think? Is there room for tough love anymore? Yeah.
It depends on how tough.
Right.
So there's definitely certain situations where you want to tell somebody to push through it, push through the pain, be stronger mentally, use your resources. If you have, a spiritual connection or you're a believer, like lean on those things. But it is extremely important to not ignore someone when they're in crisis, because at that point, it is difficult for them to access their skills and to think clearly. So no matter like what they've been told or what they've learned, they may not be able to do that in that situation. So you could have a dead child or a dead loved one. And that is what I see every day. So it is extremely important to me, and I'm extremely passionate about not ignoring things, because I have, family members who we were raised like, you do this and it'll be okay. You don't talk about those problems in this house, and you don't talk about what's going on in the family outside of this house. So you need to make sure that you're creating a safe space for your loved ones to come to you when they're in crisis, and then you provide them with the support that they need to get through it. But don't ignore it, because those are the things that we really regret when that happens.
Yeah.
So
That's an excellent point. Thank you for making that distinction. And as you're talking about people in crisis, do you want to go ahead and talk about the National Suicide Hotline crisis line?
yes. So when someone is in crisis, and that's pretty much if they're threatening to hurt themselves or threatening to hurt others, or you've noticed some very bizarre behavior and you're concerned about them, it's best to either get them to the nearest emergency room. And if you can't do that safely, you call 911. If it is not that acute, you can always call the National Suicide Hotline or text them, and that is 988. And they are open 24 hours a day. You can also reach out to your local mobile crisis centers. And so you can always like Google, Wake County mobile crisis, and they can sometimes come to the home to assist in emergency and to try to figure out what is the best course of, plan or safety.
Yeah. Thank you so much for mentioning that. I wanted to give a shout out to Dr. Watson, or Professor Watson, as two of your students have reached out via online and asked a couple of questions that I think we've talked about a bit, like some resources in the triangle that are easily accessible, which you mentioned. And I think this question came from, I apologize, I was late to these questions. I did not see them in the chat at first. The changes that we were talking about during the pandemic, was that recently, or have these been going on all along? And I think we talked about, we've seen an uptick in some of the mental health, concerns, anxiety and depression, particularly before the pandemic. And then they kind of exploded during the time of the pandemic and beyond, right? So, but thank you for Professor Watson's students for reaching out and listening to us online.
Yeah, they're getting extra credit, so that's why they so it's good that they sent questions.
Fantastic. Well, we're coming to the end of our hour. And I just want to say thank you all so much. One, to the barber shop for having us and for your commitment to being mental health advocates in the community. Thank you for people who came live and in person and asked us questions, and those online who sent in their questions or comments. If you all want to just kind of go and just kind of one parting either thought or encouragement that you can offer to our community as we're signing off and talking about mental health, is there one parting thought that you want people to remember during this time?
Yes, I think it's very important to be able to identify signs and symptoms so that we are, or learn what they are so that when we see them, we can do something about it instead of not knowing what they look like and so not being able to do anything. So I would encourage that everyone take the mental health first aid training so that you can be aware of those signs and symptoms.
I can add that when we're seeing signs and symptoms of mental health disorders, please, reach out to your primary care physician. It's sometimes hard to get in a psychiatrist very quickly, but that is usually the first route. And then when you have a discussion about medications, please keep an open mind. Ask questions about the medications. A lot of times we have misinformation and there's valid concerns, but if you ask the questions, usually your provider can help you understand why you're taking medication. What is the medication supposed to do? And for me, I never give a family or children medications that's going to hurt them intentionally or going to make them a different person or going to change their personality. And so that is a lot of concerns that I hear. But if you ask the questions and a medication doesn't make you feel good, we can stop it. So that's one big thing that I do want to make sure we talk about, because we didn't get a chance to talk about meds. But when you need meds, there is a reason, and it is always worth exploring that option if that is needed.
As a community engaged practitioner, I am excited about this work that we're doing in the community. I am excited that this is a safe space, that it is a brave space, and that we've created this environment for people to come in and offer questions, and that we have this expertise here. So this really does make me happy to be here. This group.
Thank you. And I think for my parting thought, I'll say, when I see teenagers, children in my clinic as a pediatrician who are really going through tough times, I just remind them, I'm so thankful that they're there. Thank you for being brave and coming and talking with us about it, and that there is help out there and things will get better. There are therapies out there, there are medication management, there are different things that we can do from a behavior and intention standpoint, and things can get better. And so if you're listening out there and you're going through a hard time and you're struggling, I hope some of the things that we said tonight resonated with you, and you're able to get the help so that things can get better. But thank you everyone for being here, and we'll see you next time.